Awesome. Hi, everyone. So good afternoon. Welcome to another session of CareerTalk Thursdays. My name's Emily, and I will be your host for today. So I would like to begin today's session with acknowledgement of country as we gather for this meeting, physically dispersed and virtually constructed. Let us take a moment to reflect on the meaning of place, and by doing so, recognize the various traditional lands on which we do our business today. We acknowledge the elders, past and present, of all the land we work and live on, and their ancestral spirits with gratitude and respect. We extend that respect to Aboriginal and Torres Strait Islander peoples here today. I'm joining the call from Brisbane, which is the traditional land of the Turrbal people. So just to introduce myself, my name's Emily, and I'm one of the Grad Australia webinar hosts. And this is one of our Career Talk Thursday sessions, which is hosted by Grad Australia. And for those of you who don't know what Grad Australia is, it's a graduate career site where you can explore and get to know graduate employers. You get a backstage view into what it's like to work in a role with them, and all the different programs that you can apply to that suit you. So if you guys are interested in learning more, you can also take a look at gradaustralia.com.au, set up your account and get notified of any open applications as well as any opportunities you can apply to. So today's session is Careers for Nursing and Midwifery graduates. And we are very lucky to have not one, but two guests who are joining us to give a bunch of valuable insights in this area. So the first guest that I would like to introduce is Hannah Chilton. So Hannah started her nursing career as an RN, and she worked in the gynecology, obstetrician, and HDU/NICU for a few years before deciding to further her education and complete her postgraduate diploma in midwifery. And while she was doing her postgraduate studies, Hannah joined Ramsay Health Care, and then after a year of learning and exploring all different areas of midwifery, she actually secured a role in the birthing suite where she found her passion. And since joining Ramsay, Hannah has continued to learn and develop her clinical practice and has gone on to study prescribing and diagnostics in midwifery to become a midwife practitioner, and has held various roles, including, I might botch these because I don't know how to pronounce these, antenatal educator. I think I botched a few before. So anyway, continuing on, clinical midwife specialist, undergraduate coordinator, Vic Fellowship Coordinator, and Staff Development Manager. So Hannah's got a lot going on. And most recently, Hannah is now the National Nursing Workforce Project Officer, and she works on projects and initiatives that support 72 sites nationally. So that was Hannah, and now I'd also like to introduce Charlene McCall. So Charlene started her healthcare as an assistant in nursing in Scotland before moving to Australia in 2012, where she finished her nursing degree and started her career with New South Wales Health in an intensive care unit. And then after completing her degree, she went on to complete postgraduate studies in the critical care nursing. As an RN, she has held a lot of positions within New South Wales Health as a clinical nurse specialist, clinical coordinator, and clinical nurse educator before moving to Cairns and joining Ramsay Health Care as the education coordinator, where she is responsible on all aspects of education over 3 Ramsay sites and supports over 600 staff. And most recently, Charlene is now the National Learning and Education Clinical Lead for Ramsay Health Care and supports all 72 Ramsay hospitals with their clinical learning requirements. And throughout her nursing career, Charlene has worked and mentored student nurses and graduates and is passionate about supporting them to grow and thrive in their clinical practice. So that is the introduction, guys. As you can tell, it's a bit of a mouthful because they both have a lot of experience. So apologies to you guys for botching certain words.
You did well. You did an amazing job.
But I think that just shows how much experience you guys have and how valuable this session is going to be. So before we kick off, would you guys is there anything else you guys would like to say or, add to that? So Hannah, is there anything you'd like to say first?
I just wanted to say thanks for having us here. I'm really excited and really excited to get into it.
Awesome. Yes, I would echo that. We're very excited to be here, very passionate about nursing, so we'd love to share our experience with you.
Awesome. Thanks, guys. So hi, everyone who's joined us. I can see we've already got a bunch of comments. We've got people from TAFE, we got people from New South Wales, James Cook University. Awesome. So nice to have you guys on here. So basically what we're going to do is we have a couple questions that we're going to go through. So we're going to start off with those, but if you guys have any questions at all, just leave them in the comments and we'll make sure we answer them. This is the perfect time to get your questions answered. As you see, we have two really senior people, so there's no better time than this. Okay, so first off, let's start off by answering the first question, which is, how did you get into the role that you are in now, and what has your career journey been? So we've kind of touched on it in my intro, but let's start off with Charlene. Would you like to take that one first?
Yes, absolutely. So obviously I'm from Scotland. You can hear that. I had always wanted to be a nurse and never really got the grades that I expected at school. So I went to a TAFE version of learning back in Scotland, which is called college. And I did a health certificate and started off working as an AIN in a small rehab hospital. From there, I was basically asked to go and further the career. They thought I was going to be a good nurse, so they pushed me to do some more learning, which I did. I did another certificate, which then took me into the second year of uni, so I was able to bypass that first year of uni. And then I finished my second year of uni in Scotland, and then we moved to Australia. So I was able to bring all of that learning over, and I was credited with most of it. The only things that I had to do were the Indigenous health and some child and family health, which is a slightly bit different in the UK. So I did that, and I qualified as an Australian nurse in New South Wales. From there, I got a place in the new graduate program, and they put me into ICU, which I was really surprised at. I thought, I'll be a great community nurse. I know I will. And then they put me into ICU, and I was terrified. I'm not going to lie, I was terrified. It's a very high risk, very fast-paced place to work, but I really learned a lot there. It was think on your feet. It really gave me that critical thinking mindset. So from there, I was there for 5.5 years. So from the day one of being that little scared grad, I was like, oh, I don't know what I'm doing here. I then passed all of my clinical ladders, just worked my way through everything onto ventilators and everything else. And yeah, I think 3 years in, I finished my postgrad in critical care. And then I became a CNS, which is a clinical nurse specialist. And then I was running the ward. I did a lot of being in charge of the ward, especially on night shift, with a lot of sick people, very, very unwell patients. And it was the most rewarding part of my job. It was such an exciting part of learning. And it just made me more passionate about what I had learned and what I wanted to teach others. So at that point, I then moved over to education, and there was a new spot, an educator role within the same hospital, but in the rehab area. So I went there, and that was the start of my education passion. I just couldn't believe how much I loved it. So yeah, I continued there for about nearly a year. And then I went to work with the Organisational Development Unit, which is in New South Wales Health. And that's basically a group of educators who travel within a certain kilometres, certain area. And they travel to the remote and rural hospitals, which again was amazing because it really took me out of that bigger kind of city vibe that I had only experienced, and took me to the places where, they really, really loved having the educators come in and to learn. And it was just fantastic. That was the most amazing job. And then I moved up to Cairns to be closer to family. And I acquired the role of education coordinator for Ramsay. And I have loved every minute of that. It's been such an amazing place to work. It's like a family environment. I'm sure we'll go into that a little bit more in detail later. So I worked as the education coordinator over 3 of the Cairns sites for about 2 years, I think. And then last year, I was seconded into the national education lead role, And yeah, I'm loving it. I've got 72 hospitals that I look after, and we do a lot of education, clinical governance. We pulled together new packages. It's just fantastic. It's totally different, but it's fantastic. And we have put out all these amazing packages for all of the new grads that are coming on, and I can safely say you will be very well supported. So that's what we're doing. That's where I'm at the moment.
Awesome. Thanks so much. And Hannah?
So I've had a long journey like Charlie. I didn't know what to do when I was in high school. I didn't know quite what I wanted to go into. So I started a nursing degree, and I found that the first year was really challenging for me because I didn't have a lot of context for what my career was going to, how it was going to progress. I knew I wanted to do something that helped people. So I studied a Bachelor of Nursing at La Trobe, and I secured a grad year in a large Melbourne public hospital. That's what we were told that we should go and do something in a larger public hospital. I didn't know a lot about the private system at the time, and because I'd never had a placement in one. So I just went on and I did a grad year in gynecology, high dependency, as well as neonatal intensive care. And I did love it, but it didn't feel quite right. I felt as though I was missing something. I really enjoyed working with the students and the grads on the floor. And I guess I wanted to pursue that a little further and go a little further into women's health. So I started a postgrad in midwifery. And to those of you who are on here who do lots of clinical placement for midwifery would know how many hours you need to complete, even as a postgraduate degree. And I kind of didn't know how to balance my my work life with having to do placement for free. So I just felt like I couldn't do the degree. And I stumbled across this advertising for Ramsay Health that had a program available that allowed me to work as a registered nurse in their hospitals while also doing placement within a Ramsay site. And I thought, this is incredible. How have I missed out on knowing about this amazing program? So I immediately applied for it. I didn't know a lot about Ramsay Health at the time. And I went for my interview, and it was really different from my interview from the public system. They sat me down, they asked me about myself, and it felt like this lovely family sort of team environment at this site. And I thought, this is amazing. Anyway, I got the job. I was thrilled. And I started my career with Ramsay. So I gave birth to my first baby whilst I was studying midwifery, and Ramsay was really supportive. So they allowed me to complete my placement like in a really flexible kind of way that allowed me to be home to make sure I could do feeds with my baby. And it was so wonderful that they went to all of that effort to make sure that I could study and progress my career as a mother. And I've now got 3 children. I've managed to continue doing my career progression at the same time because they're really important to me, both of those things. So that was my first experience with Ramsay. My first year there was a huge amount of support, a huge learning opportunity and flexibility. So I was really excited by that. And it made me want to continue my career within Ramsay to see what other opportunities would be available to me and in that team sort of environment. So I wanted to further my education a little bit in working with students and grads. So I took on the clinical undergraduate clinical facilitator role and undergrad coordinator role within my site, and furthered that on to work as midwifery educator in the unit. And during that, I went back to kind of challenge myself academically as well. I'm not a naturally very academic person, I feel. So I needed a lot of support taking on these challenges, and I had good support at the hospital. Even with my academic side, I was able to go to the education team for help. And there was a lot of good resources as well within the hospital that obviously Charlie knows a lot about because she works with that team. So I took up those opportunities to help me with my prescribing and diagnostics to become a midwife practitioner, and Ramsay fully funded me actually to take on that opportunity. I asked my director at the time, would you fund me to help me do this course? She said, absolutely, let's go for it. because they were really invested in seeing me grow and being able to apply those skills to our patients. So I did that. I moved into a education manager's role at the hospital, and also a Victorian graduate coordinator role, looking at coordinating our fellowship program for our grads throughout Victoria, which I love because I love working with grads. And honestly, even though it's been more than 10 years now since I've been a grad, it feels like yesterday. You don't forget those things. And that led me on to what I'm doing now, working in National Nursing Workforce as a project officer. So looking at creating opportunities and projects for not only our nursing staff, but our student nurses and our grad nurses as well. So yes, loving working in this role, and it's been an adventure to get here.
Awesome. Thanks, Hannah.
No worries.
So we've actually had a bunch of questions in the comments already. What I want to do is I just want to go through 2 questions that were addressed to you, Hannah, just while you were speaking. We'll go over those, and then we'll go over one of our questions that we have set up, and then we'll get through the remaining questions in the comments, just so we can make sure you guys get in everything you need to say. So Hannah, someone asked, does that mean you were paid for placement hours?
So it means that I was paid 2 days out of 3. So I got paid to work in the postnatal ward because I'm a registered nurse. So I could take on a patient load looking after post-operative patients after Caesars. I could look after new mums, and in the capacity of working in special care nursery, I was already able to do that as a registered nurse. So yes, they paid me to do those placement hours. And then my 1 day a week was supernumerary and birth suite, which was unpaid because that's a new skill for me that I was learning. And it was a wonderful model, and it was very flexible. So, if I needed to do some extra placement hours, they would be really, they would be able to cope with that on the floor. They just say, great, you want to work in on Friday afternoon, sure, jump in. So achieving my births and things like that was really easy as well. So I loved that model, and it worked really well for my family.
Awesome. And then the second question that was for you as well was, do all universities allow this?
So it wasn't about the university. So yes, in a postgraduate degree, universities have flexible arrangements with your work placement. So it's just about finding the hospital or the site or the, the healthcare setting that will fund you to do that. So Ramsay Health is one of those sites that would have that flexible model, yes.
Awesome. Okay, guys. So we'll get through the remaining questions soon, but we're just going to jump over to some of our questions we prepared. So this is for Charlene. So what was it like moving from the public sector to Ramsay? What's different, and what are the opportunities that the private sector can offer you?
Yeah, well, it's very different. So obviously in public, it's public's huge as well, but sometimes you can feel a little bit lost. When I moved to Ramsay, I felt it really is like a family environment. It's when they say people caring for people, it's really true. You don't just feel like a statistic. People go out of their way to know your name. They go out of their way to be kind and helpful and supportive to you. And that's one thing that I really, really noticed, walking into a public, you could walk past 100 people and it's still a great job, still fantastic work that's done. But from a personal perspective, I always found that, I'm a friendly person and love to say hi to everyone, but you just don't know everyone's name. And whereas in Ramsay, it was just fantastic. From day one, I walked in the door. I shook hands with the CEO and the DCS, and it was from there everyone knew who I was, and it took me a bit of time to learn who everyone else was. That's but it's so it's just so, and I genuinely mean this, it's like a family environment. You're supported to the hilt. It's a very, very collaborative. There's a very collaborative approach with when you've got ideas. I have to say that I have been given such great opportunities to enhance education even within my substantive role at the 3 sites. And I really just felt like it was a place that really looked after its staff and really makes you feel really wanted. and they're very, very good at patting you on the back when you've done something really well. Like they acknowledge the good that's done in Ramsay, all the way through, not just at site level. It's acknowledged all the way through. I'm sure Hannah can touch on this as well, but we have, Preceptor of the Month awards, where our preceptors, who are the people who will be looking after you, you can nominate them and they win like $100 voucher. And I mean, it's just such a great place to work, and you're recognized for the good work that you do. We do have fantastic clinical pathways, career pathways. So you're not just in and stuck where you start. There's such a great variation of places to go. All kind of moving. I don't know if that's a question later on or not, but it's all moving through the rungs to, from RN to CN to, at that point, do I want to go into a leadership role or do I want to go into an education role? There's so much opportunity, and I really, I'm really happy. I'm very happy that I made that choice and that jump.
Awesome. Thanks so much. So next question we have, Hannah, it's what are the opportunities for graduates to continue to develop and learn once they commence employment?
There's lots of opportunities. So many I might not be able to list them all, but I'll touch on the fellowship program. So our graduates are brought into a 2-year program. So the first year is a foundation year. It's kind of more like a traditional graduate year. And the second year is a development year. So the first year is where the grads have that opportunity to kind of transition their theory to practice. They get to consolidate, they get to build relationships and get to feel at home and build that, confidence that you need as a clinician. They'll attend national study days with the rest of their graduates across 72 sites. They're amazing these days. It's a really lovely environment. There's lots of chats. There's lots of opportunity to kind of meet your fellow grads from across the country, as well as learn a lot. So I do enjoy attending those days as well. We then have, on the site, there's a lot of support as well. So you've got your orientation to site, your supernumerary time. You've got layers of education support, so preceptors. You've got your facilitators, your educators, specialty educators and managers, education managers, as well as, the rest of the other staff that are there to support you. And there's a lot of opportunities for you to access internal education at site level throughout that year and support and debrief, et cetera. And towards the end of that foundation year, you meet with your education team and your education manager to discuss opportunities for your second year and where you'd like to take your career, because, it is hard. Not everyone knows where they want to take their career right from the get-go, and you may not know that after the first year of nursing or midwifery, and that's okay as well. So it's all about discussing what do you want to do and where do you want to go, and or how can we offer you a few more opportunities to try. So in the development year, that second year, you might choose things such as just some ongoing employment in that area just to consolidate a little further, or, to specialise within that area that you've already been working in. You might choose to go on as a registered nurse or registered midwife to go on and do a postgraduate degree. We've got amazing 20 plus streams of specialisation of highly subsidised courses through the University of Tasmania, which is virtual education. So you can do that from anywhere within Australia, and that's special for Ramsay staff. You might want to, as enrolled nurse, go on to do a Bachelor of Nursing if you want to. So we have EN to RN's transition course available for you, and that is supported by Ramsay. You may want to do some external, courses. You can apply for a Ramsay scholarship. We have a whole range of different scholarships available, not just to our graduates, but to our staff at all times. You may want to transfer sites. So you might want to try a new specialty, and this specialty might be interstate. Well, we've got 72 sites nationally, and you can transfer within them. So it's a beautiful network of hospitals. Once you're a Ramsay staff member, you're a Ramsay staff member wherever you are. So we're very happy to support your transition. It's about, being able to support our nurses and midwives to go where they want to go in their career. And that might be to a new site, to try a different opportunity. That's okay. So we're very supportive to make that happen. Or it might just be you want to try a new rotation within your hospital. That's okay as well. So we can continue on your rotations. But there's lots of different opportunities to upskill internally with our courses. So obviously Charlie Space has a lot of internal training opportunities, whether it be My Learning, whether it be novice programs or transition to specialty practices, or we might go the external route where Ramsay can support you to upskill your education. So wherever you'd like to go.
Awesome. Thanks for answering that. So we should get into some of the comments in the questions we have in the comments, because there's a bunch of them. So thanks for being so engaged, guys. If you do have questions for Hannah or Charlene specifically, feel free to put their name in as well, so we know who we can address it to. I'm just going to quickly go through these comments. So I feel like you guys have touched on a few of them already. So if you have, that's okay. We can kind of move on to the next one. But I'll just put them up on the screen. This is the first one we have. A little bit on what we just talked about, but it's about, I'm really interested to hear how Ramsay supports new grads with the learning. So any details of how new grads experience their learning would be appreciated, please. Is there anything else you guys want to add to this? I feel like we have touched on this just before.
I think it's about kind of tailoring the education to what you want. And I think Ramsay's quite good at that. We like to we actually build in time for you in your graduate year to discuss options with your education team, because we want to be able, you're not just a number in the system. That's not how we like to run our graduate programs. We like to tailor them. So if you often nursing grads who are coming into the program say, well, I really love mental health, but I also really want to do general stream as well, and I don't want to have to choose between them. That's okay. We can do a rotation through both of those areas. If that's what you're really passionate about, let's work out how we can do those things. So it's about just communicating with your education team about what's important to you.
Awesome.
Yes. I would also add that you do have your grad facilitator on site, and your educators on site every day as well. So that's important to know, that it's not just the graduate online part, the fellowship, the study days. You've got someone all the time on site. So that's really important to remember.
Great. And this is another question we had as well. Is the grad program full-time, and for how long?
So the grad program can be full-time, or you might negotiate a part-time contract if that suits you better. It's all about just in your interviews or in your cover letter as well. You might want to address what your preference would be. And then you can discuss at interview what that would look like for you. And the program runs for 2 years. So the foundation year is 1 year. So it's like a general graduate year, and then your development year with your opportunities is in the second year. Once you've completed that program, you have ongoing employment with us. You don't have to re-interview for a job that you've already been working in. You just continue on with us.
Awesome. Thanks for that. Got one more question before we'll go back to the other ones. So I've got Kelly's asking, I'm very interested in knowing about post-grad programs and if it's hard to get into a postgraduate position with Ramsay. And they've also said that they are worried about how hard it is to get employment as a newly graduated enrolled nurse. Charlene, did you want to answer that one?
Yeah, it's very exciting because Ramsay has basically opened up way more places for our grads now. So there's so much more opportunity than there was before. And yeah, that it's not as hard as it may have seemed before. That's why I would say, especially for Ramsay, it may be in the public, I'm not sure. However, for Ramsay, I think we've actually nearly doubled the amount of grad places that we've got. And bear in mind, that's over, we've got 72 hospitals, all interstate. So you've got way more opportunity and chances to get through. And we're more than happy to extend that as well. If we have the right people, we are not going to pass up having the right people come to work with us. So the opportunities are definitely there. It's not as hard as it used to be, I would say.
Awesome. Okay, thanks for answering those ones from the comments, guys. We'll jump back over to our ones, and then I promise you guys we'll get back to all your questions in the comments. So this is a question for Charlene again. So it's, what are the different areas or career paths within nursing? Where can an RN/EN go beyond their graduate program?
Yeah, absolutely. So I kind of touched on this before, I tried to hold back a little bit. So if you think about once you graduate, if you're an EN, there's opportunities if you don't want to go into the grad, the RN role. We do have some ENs who are doing work health and safety roles and things like that. So there's places you can go if you don't want to go to the RN route. But when you're an RN, you can move up the ladder. You can, obviously, all of the education's there. We support you to do your postgraduate, and like Hannah had said before, UTAS is affiliated with us, and we have specific postgraduate courses as well, which is really exciting. So there's that, and then obviously there's the opportunity to go in two directions. So you can go from RN to clinical nurse. And then from there, you can make the decision, where do I want to go now? I see myself more as a leader. I like the look of management. So then you could go to the ANUM, like the assistant NUM or acting NUM. And then that gives you opportunity to do the leadership course. And then you can become a NUM. From there, I'm just following the leadership pathway right now. So from there, you can think about, okay, I've been a NUM. I want to go a little bit higher. I want to do more kind of governance work. So then there's the quality manager roles. There's the DCS role, the Director of Clinical Services. You can always do after-hour nurse manager, which is the role where you do all the after-hour. You basically look after the hospital, once everyone else has gone home. That's a fantastic job. That's a very skilled job where all your clinical skills need to be absolutely high level, which is exciting because everyone depends on you when you're in that role. Everyone depends on you when you're in the other roles as well, but that's quite a good clinical role to have in a leadership environment if you want the mix of two. And then obviously you can move from DCS to CEO and then upwards into the national, executive and head office team. Hannah and I sit within head office at the moment, and it's amazing. Like sometimes you just can't, you have to pinch yourself because yes, you've put the hard work in, but the opportunities are endless in Ramsay. They really are. You can do anything. So that's the leadership side of it. If you become a CN and you think, okay, I'll do my postgrad and I want to go maybe more into education, then there's opportunity to do the clinical facilitator role, which is the person who would be looking after the grads and the students. The clinical educator role, which is the role that both Hannah and I have sat in before. We obviously chose the education side of things and the clinical side. And then from there, you can look at, nurse specializations. You can look at what was it you did, Hannah? The midwifery prescribing.
Oh, I did the prescribing and diagnostics.
Yeah, so you can do you can do nurse prescribing, all of that. That involves a university degree and an extra university course, but it's amazing. And Ramsay will always support you through all of that. One thing I would say as well is we have resources there to help you if you want to do any external courses as well that we aren't offering specifically. If you see some sort of workshop or conference or something that you feel, if I go to that, I can bring so much more back to the role that I'm doing now, then Ramsay can support you to do that as well. So the opportunities are endless, and just be open and speak about what you want to do, and you'll be supported for sure. And the thing is, a lot of the time, like I said before, when everyone knows who you are and knows your name and says hi, people watch and they watch what good job you're doing, and they watch out for you, and they think, okay, she might be good or he might be good doing this, and have you ever thought of maybe you'd be a great leader, or so that people will comment on how good you're doing, and where maybe that you haven't thought before that you could be a good leader. Other people might see you as a good leader. So having that and having that support network around you is so important, and it's something that happens in Ramsay every day.
Awesome. I love how supportive it sounds. It's so nice.
It really is, honestly. It really is.
Very theme that you can like pick up very strongly from all your answers. That's super supportive. So Hannah, I have a question for you. Your question is, what steps should nurses wanting to specialise take?
That's a good one, because I've experienced this, and I guess my first piece of advice would be to talk to people about it in your team or in your clinical environment that you're passionate about. So ask them how they got to their roles that they're in now. Ask them the steps that they've taken, and tell people that you're interested in moving forward in your career. Be noisy about it. I mean, I certainly have been over the years. If I want to do something, I tend to be the person that goes, well, how can I get there? How can I get there? Who can help me? I think Ramsay has been quite, it stands out to me in the different hospitals that I've worked in, because those opportunities are kind of presented to you quite early on in your career. So they ask you, where do you want to go? How can we get you there? Which is nice. But when you're on the floor, the first step would be kind of taking up all of those internal opportunities to upskill. So whether it might be education sessions and, workshops, or transition to specialty practice programs, or novice programs within Ramsay, take on a couple of those and try out your specialty and see if that feels right for you. And then ask, your preceptors or your teammates or your educators, what's the next step? And Charlie has developed some really amazing clinical career pathway documents, which really outline beautifully, step by step, how do I get to this career pathway? How do I go down this pathway and specialize and upskill? So going through one of those is amazing, and I've definitely used them as a resource for myself and for other staff as well, which were really good. And never settle for no, you're not ready for that. Because it's not that I've come across that a lot in my career, but if anyone, or even that internal voice telling you, I'm not ready to take on this specialization, don't listen to that. Just do it. Go for it. Give it a shot, because you can only gain knowledge. And I guess nursing is really lifelong learning, and we do support that here. And just because you become a specialist in one area doesn't mean you can't go and become a specialist in something else later on. So don't be afraid to take steps to specialize. It doesn't mean you're losing all your skills or you can't change career paths, because nursing has infinite opportunities. And being in a network of hospitals so large, like Ramsay has, of 72 sites, all you need to do is go, right, I feel like I've really, gone as far as I can with this specialization. I'd like to try something else now. So that's okay as well. I think that's probably where I would suggest going. Just go for it.
Sorry, my mic was muted.
Yeah. I thought it was me.
No, you're fine. Okay, guys. So for everyone commenting, we are going to get into some questions in the comments. So first up, we have Ian, who has asked about graduate intakes.
Mm-hmm.
So when are they? Yeah, when are the graduate intakes?
Do you want me to take this one, Charlie?
Yes, please.
Yep. So we have a February and an August national intake, and these are, you apply via our careers website. So if you go to ramsayhealth.com.au and look into the careers section of graduates, you can apply now. So our our February intake is now open for 2023. Saying that, if you graduate outside of these times, or you want to apply outside of these times, we will absolutely accept your application. So you can actually apply directly to our learning workforce team as well. So that contact information is there. So don't feel as though you're restricted. We don't want to, my greatest fear is to have nurses sitting at home wanting to work. We need you in our workforce. The patients need you, and we don't want your skills going to waste. So if you'd like to start a program outside of those times, please send your application through.
Awesome. And then next question we have is just about grad year versus going straight into working. So Charlene, did you want to take that one?
Yeah, obviously, when you're a student and then you become a grad, it's, you're in the grad program, you're fully supported. And I see from the question there are conflicting thoughts in regards to doing a grad year. Obviously, in that grad year, you're definitely going to have that support. You're signed up for it. You're going to have your main study days that you're going to attend, and just get that knowledge and that support around you. I strongly suggest you do it, the grad year. I mean, obviously, in times gone by, both public and private, perhaps people missed out on grad opportunities. But I would definitely say for Ramsay, and just echoing what Hannah's just said, we have practically doubled our offerings, and then there is the opportunity to come in midway through the other intakes as well. So we're trying to make it as easy as possible for you to get onto a grad program. So take it up, because you're going to be supported. You're going to learn so much more. You're not going to be thrown onto the ward and not know what you're doing. And this grad program is fantastic, and it just speeds up the process as well of where you're going to specialise in. And you've just got that, those arms around you, taking you through, supporting you all the way. So I would definitely say do a grad program. It's, I did it and I don't regret doing it. It was fantastic. And yeah, I think our program specifically in Ramsay is an absolutely fantastic program. And it is, people just, they care about you. They care about how you learn, and they care about where you're going in your career, because let's be honest, we all want to work with the best people. So we support them to be the best.
Awesome. Thanks for answering that. So Hannah, I have a question for you. It's about late bloomers. Can they apply? Do you take mature age students?
Absolutely. Life experience is very valuable as a nurse as well. Though, we do not, also other careers that you've been through are a wonderful addition to your skills. So absolutely, we take into our grad program, we take enrolled nurses, registered nurses, double degree, midwifery nursing, single degree midwifery, allied health. We take pharmacy interns. We take international students. We take mature age students. We are more than happy to receive your application, and you'll be an addition to our workforce. So yes, absolutely.
Awesome. I would echo that. Yeah, definitely. Yeah, it's your life experience is fantastic for us to have on board. That's not even an issue. We welcome that with open arms.
Awesome. I think that ties into the next one, because Hannah, you mentioned international students, and this question is about international students. So yeah, the questions are the opportunities to get into new grad the same for international, or is it like the public system?
No, we are very, very much encouraging to international students to apply to Ramsay. We would welcome your applications. We have clients coming from all over the world. So your skills are very valuable. Your culture is very valuable. And we really encourage you to apply. Absolutely.
Awesome. And I think we have one more question that we'll go through before we get back to our other ones. So Charlene, would you like to take this one?
Yeah, I could probably, I may have to pass that one to you, Hannah.
Yeah, that's fine.
Yes, so it is studied through university. Yep. We just support you. We support you with clinical placements, and we support you with studies. So it is definitely done through university. It can be of your choice, or it can be through Ramsay affiliation. Yes.
Awesome. Okay, thanks, Haz. So we've gone through a few of those ones. There's still heaps which we'll make sure we get through, but we'll just jump back to some of our questions. We don't have too many more of them anyway. So we've got, this is for Hannah. So it's, what can graduates do to stand out during the interview process? And also, what do you look for in graduate nurses?
With graduate nurses, to start with, I really love looking at their cover letters. That's the first thing I'll read. I skim over resumes because I have a look at your experience with clinical placements, but I generally love to read a cover letter about why you want to come to Ramsay. That's what I want to see. How do you connect with Ramsay, and how do you connect with our hospitals? Do you align with our values, that sort of thing, but more so about your personal experience. So whether you might have had a placement with us, you might have had a family member at Ramsay, or you may have just heard from your friends that they enjoyed a clinical placement with us. You don't have to have a personal connection, but I want to know why you want to come and work with us and where you see yourself working with us in 5 years. Where would you like to go? You don't have to make any commitments, but it's just a little bit about you and what you're passionate about. With the interview process, you do a group interview to begin with. So you may be in with a few other grads, and that's a little bit daunting. I know it can be, and there's usually a couple of educators in those group interviews, so it's an online interview. And I know that as a graduate, I did a group interview and I felt as though, how am I going to stand out in this environment? You don't have to stand out. You don't have to be the shining star and know all the answers. I'm still watching everyone in that interview process. Just contribute where you can and where you feel comfortable. We generally do ask a clinical scenario, and I just want to remind all the grads or all the students here that are going into a graduate program, remember that you don't have to know everything in that clinical scenario. You need to know a graduate level. So you just need to know how to assess, how to identify deterioration and escalate that. So how to get your help. So I think just remember that we're all humans too. We've all been in this position. We know what it feels like. And we don't expect you to, jump out of the page at us or, dominate the interview. You don't have to do that. Just a little bit of contribution, teamwork in the group environment is really important as well. That's what I look for. How can you support your team members? A little bit of, yeah, that's a great suggestion. I really appreciate you, highlighting that part. That's really lovely to hear. With the one-on-one interview in the second round, we ask people to come back and have a chat with us. This is a little bit more of an informal interview, I feel. It's about getting to know you. So we want to hear about, why you want to come to Ramsay, what you're passionate about, what type of person you are, how you see yourself working with our teams, that sort of thing. So I think just being yourself, really. A lot of nurses, this comes very naturally for them, is just being warm, open, and taking a deep breath and just taking it one step at a time.
Awesome, thank you. And I think being yourself is like the biggest thing, like in all interviews, regardless of the industry. Just like take a deep breath. It's not the end of the world, and I think that helps so much.
I think it's important to show your vulnerability because you don't know everything yet, and we are here to support you to learn those things. But your vulnerability is something that everyone has it, but if you show it, then we know that you're open and you're willing to move forward and be supported in your learning, adventure that's ahead of you. So yeah, be vulnerable. Don't be scared to be vulnerable. It's okay.
That's right. And we're here we're behind you. We're not there to judge you. We're there we're excited. We want to have you as part of our team, and we're there hoping that you do really well, and we want you to succeed. So, if you need to ask us a question, or you need to say, I need to take a breath, have a little sip, and can you tell me that question again? That's okay too.
And always remember that those people who are interviewing you, or even the people who you're working with, they've all been there. They've all been a brand new nurse at some point, or been in a grad program. They've all been vulnerable and they've learned. And, that's something just to always remember that in the background, that this person who's sitting in front of me has been here too. And they understand what I'm feeling right now. And that's something really special to keep in the back of your head when you're doing these things.
Awesome. Thanks, guys, for answering that question. I just have another one for you, Hannah, now, which is what are the first few months like as a graduate nurse?
I know that Charlie will know exactly what this feels like as well. And I'm going to talk to this from personal experience, because I remember it like it was yesterday. And I think, that feeling when you're going out on your first clinical placement and you feel that mix of emotions, that nervous energy. I'm anxious, excited. I want to impress, my leaders. I want to be able to practice competently and safely. I want to stand out, but I also don't want to ask silly questions. That's okay. All those feelings are really normal. Remember that you have resources on the floor. You've got your team, you've got your preceptors and your facilitators and your education team. They know you're new, they know you're a graduate, and they're there to help you. The nursing industry is really lovely in the way that we do take care of our new starters, our new grads, and I do love the grad label. That's why I do love being able to have that year where you get to wear that grad badge and go, hey, I'm a grad, all right? Everyone needs to be patient with me. I'm still learning. So it can be really exhausting that first few months. It can be overwhelming, and that's okay. That's normal. It takes that period of adjustment because you're trying to work, you're trying to learn new things, you're trying to adapt into a new environment, and that's tiring. So that reality shock does kind of set in a couple of weeks in. That's all right. It does pass. So find your safe space for debriefs when you need to. So that might be with your education team or a colleague on the floor to have a clinical debrief. Not every day is going to be perfect. I think you need to remember that and be kind to yourself, that you're human, you're going to make mistakes. Sometimes you're not going to prioritize things perfectly. That's okay. If you need to delegate, that's what a team is there to help you with. But eventually you're going to start to adjust and you're going to start to feel more comfortable and you're going to feel empowered and you're going to have great days, and your clients are going to come to you and say, oh my God, thank God you looked after me today, because, you were there, you listened to me, you listened to my needs, you were able to provide me with comfort when I was feeling really, really vulnerable. And you'll start to feel better about, working independently. And it's a really great feeling. And remember to be proud of yourself each day and highlight all of the good things that you've been able to achieve, even on the worst of the days. Whether it was just that you got all your medications done on time, or whether it was just, you finished your notes at 3:30 on time. So, all of those things are positives, and then the cycle will start again because you'll start to feel really comfortable, you challenge yourself, and then you're back to being a learner. So it's normal. Just be kind.
I would also just add, keep your expectations realistic for yourself. Everyone's different. Set yourself realistic goals, and just don't over push yourself in the first year. Just try to focus on what you need to do, and don't overexert yourself from adding more to your plate that you don't need right now. Sometimes you'll have grads that are like, yep, I got it, I'm good, I can go, and then they start themselves as quickly as possible in a post-grad, and you're like, just take a breath, because it's hard work, just like Hannah says. Some days aren't the best, but most of them are fantastic because you've got that support there. But I would definitely say just keep your expectations realistic, and the support that we can offer you is far beyond anything that I've ever experienced elsewhere. So you're in good hands when you're with Ramsay.
Awesome. Love it. Awesome. So time for some of the questions from the comments. So we have, start you off with the first one for Charlene. So can you please give some examples of specialties?
Yeah. So you obviously you can start in general medical ward. You can move to different areas. You can, or let's just say you go into orthopedics. Let's say your first year or first 6 months, however it's going to work, you're in orthopedics, and you're getting all of these people through, and you're thinking, wow, wonder how they actually, wonder what that operation actually looks like. Oh, I've started to get a real fever for theatre. I'd love to see what that's like. You can literally talk to your facilitator, talk to your education team, and then they can talk about where you want to go next. And if you want to move and make that journey into theatre, we have a specific novice program that we would get you on. That's another speciality. Obviously, midwifery is another one, and we have all of that, all of those resources there to help you to do that. It's endless, to be honest. We have multiple different areas. We have ICU, ED, we have HDU, we have cardiac wards, we have general medical, surgical, pediatrics. There's so many specialties, and nothing's holding you back from any of them, to be honest. And usually I think in the interview period, You will be asked what you're keen to try, and they really do try to put you into the area where you've specified that you would like to go. Sometimes not on your first rotation, but usually on your second. So you usually get a good opportunity to experience what you think you want to do. And sometimes that works perfectly and you love it. And other times you're like, okay, this is what I thought I wanted to do, but now I don't, and I want to try this. And there you go. You can move into that. You just have to have that discussion with your education team, the NUM that you're with, and the receiving NUM, I think, as well, who's ready to take you on board, kind of thing. But it's a simple maneuver to get you to go where you want to go. And Hannah mentioned earlier the career pathways that we've developed in the team. We've got 42 of those now. So 40 of those are covering all of the different units that we have, general medical, orthopedic, all of that. Then we've actually started to add the next level up. So your infection control coordinator, your education coordinator. So if you're working through and you've done your grad year and you think, okay, I'm doing my fellowship year now, my second year, finding that you want to move into that post-grad education time, or you want to start maneuvering through the career pathway, those particular documents are really good and very, they'll give you an idea of what you need to do to get to that next pathway. And they're pretty simple. So yeah, it's an easy way to maneuver your way through the different specialities.
And I think it's important to add as well, I think a lot of students don't realise as enrolled nurses that they can specialise as well. So in Ramsay Health Care, if you're an enrolled nurse, you can work in specialties such as the maternity unit, you can work in theatre, you can work in mental health. And we have internal upskill programs to support enrolled nurses in those specialty areas. So, I think that's a wonderful opportunity that people don't realise when they're studying, that going into the private healthcare sector, that you're going to be provided with these opportunities to specialise.
Awesome, thank you. So I've got more to go through. This one will be for Hannah. So this person hasn't had a placement in Ramsay. Will it affect their chances of securing a grad program?
No, because lots of students wouldn't have had a placement with us. That's okay. This is a great opportunity for you to try. And your interview, in your group interview and in your one-on-one interview, you'll be offered the chance to ask some questions. So it's very much okay to ask about what hospitals and what specialties they have and what opportunities lie ahead for you in those interviews as well. So it's just about us getting to know you, but also about you getting to know us.
Awesome. And whoever wants to take this one, do you have sponsorships in Ramsay?
I was going to say we have we're just started the international graduate, or we're working on that at the moment, the graduate program. I don't know if you know more about that than me, Hannah, at this precise second, but
there are sponsorship opportunities in Ramsay. The details of those we'd have to go into quite specifically. So if Mika wants to reach out to me directly, I would be more than happy to go through them with her. We've got our contact details up at the end, do we?
I don't know if we do, but we can, if you guys want to put them in the comments.
Yep, I'll pop my email into the comments.
Yeah, I can pop that in if you send it through private chat, or you can just put it in straight away.
Yeah, sure.
Okay, so yeah, everyone, check the comments if you want either of their details. Okay, let's continue with the questions. We've got heaps of questions, which is awesome. Thanks so much for all the engagement, guys. Okay, I've got this one from Charlotte. Hannah, is this something that you can answer?
Yes. So regarding the new grad program, we're able to do our new grad year at one specific location over various wards. Yes, absolutely. Yeah, you can go to one specific site and do a range of rotations within that site. So you might do 1 or 2 rotations in your first year, but you may choose to go on to do another rotation in your second year if you haven't found that kind of your home base yet, definitely you can stay within that site.
Awesome. And Charlene, do you think you can add any advice for this commenter? They've said, as an EN student about to finish in November, they're just lost about what to do.
So lost as in, from what I'm reading into, lost as in what to do next. Is that, yeah?
I would assume so, yes.
Yeah, so if you're lost because you don't know what the next step is, then apply to us and we will get you, you'll get your grad interview and whatnot. Just apply. There's no stopping you. If, I would encourage you to do that. Don't be lost and sitting at home thinking, what do I do next? Come, just approach us. We want you. We want you, like Hannah said before, we want you to come work in the hospital, be with our patients, give them the best that we can possibly give them. And we want you to learn. We don't want you to be sitting there worried about what the next step is. So just apply through the graduate program online. And like Hannah says, we take EN grads as well. It's not just RNs. So absolutely apply and get yourself on the workforce. It's the first thing you should be doing. Absolutely. Think of the next step. Always give yourself a focus on what your next step should be, and then you won't feel lost. Try to think of the next step all the time, and we'll welcome you.
Awesome. And then we have another question. Hannah, would you like to answer this one? So just I have just finished uni and grad year doesn't start until next February. What should I be doing in the meantime in relation to working in health?
So if you've got your registration through, you can start with us now. If you'd like to hold off, if you want to wait till a February intake, that's okay as well. You can find employment within our Ramsay hospitals as an AIN, assistant in nursing, or it might be in any of our other areas. So please feel free to apply. We have, or reach out to us. If you would like to work, we are very willing to receive your application. Absolutely.
Awesome. Okay, and we have more questions. Okay. So whoever would be able to answer this one, if you are due to graduate from a degree studies in February, are you still eligible to apply for the February? Oh, I think that kind of answers what we just talked about a little bit.
Yeah, if you're worried about getting your registration time through in time for the February start date, don't worry too much about that. If you're due to finish in February, I'd still apply for your February intake because we can adjust that start time by a couple of weeks. That doesn't matter. So please do still go ahead and put your application in.
I think just to answer those types of questions in one way, just basically reach out to us. If you're unsure on what to do, just reach out and we will give you the answers. Don't sit there worrying and like, oh, I need to wait 3 months now until blah, blah, blah. Don't do that. Just reach out because basically there are ways and means of us to get you on board in whatever capacity, whether it's you're waiting for your registration and we can bump the start time out a little bit, whether you're not registered yet but you need to work, so there's AIN roles that you can do. So there's lots of different things we can do to help you get into the workforce before grad time. So please just reach out to us. I think that's the most important message that we can give you because we're here to support you.
Awesome. Okay, so we've still got heaps of questions. So I think we'll try ramp it up and just speed through them to make sure we can answer as many as possible. We've got this one here. Hannah, would you like to take it? So over the 24-month program, can you choose multiple locations or is it one location?
You can choose one location or you can apply to rotate to another site. That is completely up to you and obviously dependent on what is available at the other sites at the other time, but we will coordinate that for you.
Awesome. Okay, and then we've got... Okay, so this is a bit of a specific one. It's just I'm in the midst of writing a cover letter for the RN graduate fellowship program, but they're not sure who to address the letter to.
You can address it to whom it may concern, or you can address it to your state coordinator, or you can address it to Ramsay Health Care. It's completely up to you.
Awesome. We have another question here. Charlene, would you like to take this one, or Hannah, whoever suits it? So how are the new grad interviews for Ramsay different from public hospitals?
Well, obviously, what Hannah's already kind of talked about how grad interviews go, and we obviously work for Ramsay. I can't really comment on how the public do theirs, but we try to make them, there's usually like a small group within the group interviews, 6 to 8 people maximum. I'm correct in saying that, Hannah? That's how our experience
that's right.
Because we have to give everyone time to answer, and there's a specific time blocked out for that. And then we do the one-to-one, those who are picked from there, we'll have the one-to-one just to get to know you a bit better. And I guess it goes back to what I said at the start. We want to get to know you. We want you to get to know us. We want you to feel like that you're welcome to work here, and that you're supported to work here. And that's why we do it that way. It works so well. And people have said, it's a bit different. They've not experienced it like that before. That's why, because we want it to be a personable experience for you. And we want you to know that you're welcome to work with us, and that we're there to support you. So that's why we do it that way. And we want it to be about the individual, to be honest. We try not to make it a one-fits-all type of scenario. Everyone is different. Everyone comes with different life life experience and skill sets, and that's where we kind of have that conversation, and we get to know where you want to work and where you might fit in the grand scheme of everything. So it's really important to us to have that time to talk to you and make you feel comfortable with the process.
Awesome. And Hannah, I just have this question here for you. So we did touch on interviews a little bit before, but it's just, could you please provide advice on what preparation we should do to give an advantage in the interview process?
I think probably just, remind yourself that it's okay to just go in and have a relaxed chat. We will ask you sort of a clinical scenario, but it's about knowing that, we expect a graduate level answer, like I said before, just about how to identify and escalate your concerns, communicate professionally, and we want to get to know you and how you see yourself fitting in at Ramsay Health Care, and where you'd like to see your career go and how we can help you get there. So try to remember to take a really deep breath before you come and interview with us, and that we're right behind you. We want you to succeed in these interviews. It's okay to ask questions, and it's okay to ask for us to, repeat the question or give you a little bit more time. We're all human, and we've all had interviews before, and we know they can be really daunting, and we're not here to make you feel, nervous or scared about this interview process. It's just about getting to know you.
Awesome.
And be yourself as well. Be yourself, because when you're trying to be something else, it makes you more nervous, to be honest.
Yeah.
Just be yourself, relax. We don't bite. It's a really nice, it's actually probably the nicest types of interviews I've ever experienced.
I agree.
And I really mean that. Is we understand, those who are interviewing you understand how you feel, and we're, we feel your emotions as you walk in the door. So don't think for a second we're sitting there going, oh, we're not. We're so supportive of you.
We're excited.
We're excited for you. Yeah. Exactly. And we're excited to see your journey flourish. The amount of grads that have come through and where they are now, we sit there like so proud, so proud. Every time I walk past some of the grads that have been, I've looked after, I'm like, oh, I'm so proud. Like, it's just amazing. So please be reassured by that. Just be yourself.
Awesome. And then we just have another question. Charlene, did you want to answer this one? It's just, as an EN, how can Ramsay support you if you want to go do your RN?
Yeah, so I think Hannah already kind of touched on this before. So we will support you to do that, the course, the RN bachelor course. And yeah, I can't quite remember what you said, Hannah. Sorry, it was a while back.
We try to support you, academically with resources, but also with placement opportunities as well. We want our Ramsay staff to, you don't necessarily have to do your placement in your home hospital. go and try out some of our other sites. I sit in Victoria. We've got 17 hospitals that you can choose from.
Yeah.
So we connect with your education provider, with your university. We talk to the course coordinators about you're a Ramsay staff member. How can we support this person? And we do have a new affiliation with EN to RN transition, where we're looking at putting the whole Ramsay cohort through in an opportunity together. So each year. So there are lots of different ways we can support you from Ramsay, but it's okay if you want to continue down the EN stream and specialise and upskill as an EN, or if you want to go on and do your bachelor, we'll support you in both of those ways.
Awesome. And also maybe a question for Charlene. We've got, do any Ramsay hospitals have an ED?
Yes, quite a few of them do. We've got some really big hospitals. You've got your, Greenslopes and all of the big hospitals. Some of the medium-sized small ones won't have an ED or an ICU, but yeah, the big ones tend to have ICU, ED. So you've got, if you're keen on critical care, just contact us. And if you're in a site or an area where we don't have one and you're willing to experience it in another state or something, then that's something that we can look into for you as well. So yes, we do everything. We do everything.
And we're growing and developing all the time. A lot of our sites are constant, like we're under construction because the healthcare sector is growing. Ramsay is growing all the time, and a lot of our sites, I know there's a couple in Victoria near me that are adding on ICUs and EDs as we speak, or developing brand new hospitals. So there's always new opportunities opening up.
Definitely.
Awesome. Okay, so I'll get into some more questions, but I just want to say, Charlene, do you think you can send me your email details, and that way I can put both of them in the banner for everyone so they can take note of it. It might be a bit easier for people. While Charlene's doing that, Hannah, can you please answer this question just about set number of places for EN/RN grads?
No, there's not. We are happy to take a mixture. We don't set a ratio. We just want to look at our applications. We want to see who fits to our hospitals. And we encourage both streams to apply. We have a huge EN workforce. So there's absolutely spots available for ENs. We very much encourage them to apply. We take up from 1,000 graduates a year nationally. So that's a huge number. And we're very proud to offer those places, and we want them all filled. If there's more nurses than that fit the criteria to work with Ramsay, and we will adjust those places accordingly. We will make room to make sure that these nurses get a spot.
Awesome. Okay, and I'm just popping up both of your details. So everyone, make sure you screenshot. This is the time to screenshot. I'll leave them up for a couple minutes or so as well. And I'll just verbally read out the next question. Okay, so got plenty. Okay, just a question on how can our cover letter grab enough attention to get us an interview? Hannah, did you want to give some suggestions on cover letters?
I think keeping a cover letter short and sweet is important. So less than a page, because we might have thousands of applications to look at. So if you can kind of dot point what you want to get across before you write your cover letter. So make 3 or 4 or 5 dot points, and then start elaborating on those when you actually write the cover letter. So where do you want to go? What specializations you can see yourself going into? Why you connect with Ramsay and our values? What experiences you may have in the past, or if you haven't had any, what experiences are you excited to have with us in the future? It just needs to be short and sweet. Even half a page is fine.
Definitely show your passion. That's what we look for. The passion, you can feel passion coming through the page when we read it. That's something I look for.
And Charlene, we had a question which is, hi there, should we or can we apply to more than one Ramsay facility for a position? I've seen that the application site says to select which facility we would like to work at.
I would imagine if you do the one, and then you can discuss that on your interview process where you want to actually go. If you want to do it, like Hannah said before, if you want to work in Victoria for your first part, but then you want to go to Queensland for your second part, then that's something you can discuss within the graduate team.
Yeah, you actually apply to, so you do one application, but you apply to a hub of hospitals. So there might be a few hospitals that you're actually applying to, and you can write in your cover letter what your preference hospital is. We're not going to hold that against you if you then change your mind. It doesn't matter. We're all the same network. But when you apply to that hub of hospitals in that interview, then you can talk about where you'd like to go ideally.
And we've got another question, which is your GPA a major factor in the interview selection process? Hannah, would you like to answer?
No. We like I said, I am not an academic person naturally. I connect with people. That's where I feel like my strong point is. And I know a lot of other nurses and midwives are the same. They have that quality, that connection quality with other people. And I look at the person. I don't look at the numbers, and I get a feel for you in your interview and through your cover letter. And I know Charlie does the same. It's about how you fit. You know, and it's just a number, the rest of it.
And just remember that we can support you as well. You know, we can support too. So, you know, I don't think I was ever the best, you know, at school, or, you know, even at uni, I was a mature student at uni, and I tried really hard, and I got a decent GPA, but had I gone from school in Scotland, it would have been a bit different. But here we're very much, and with Ramsay, we're very much about the people. When you get into Ramsay, that's when the support happens. That's when the learning really happens, when you're on the floor. I was never good at exams. I used to just go blank when I did exams, like in that exam pressurized environment where you're sitting at the table and you're like, oh, all the stuff I know, it's just gone, which is not, but you put that pressure on yourself. So no, your GPA has nothing to do with it from the perspective of, obviously you have to get your diploma or your degree, obviously, but once we don't look at GPA at all. We look at the person. We want good people in our hospitals looking after our patients, and we will support you to do that.
Awesome. And I think this will probably have to be our last question. We've got a ton of questions, and I wish we could answer them all for you guys, but unfortunately it's coming to the end, and there's still one more question for Hannah and Charlene to answer that I have as well. But we do have their email details here, so make sure to take note of that, and you can always reach out to them. There are a few questions I missed because they have been answered already at the start of the webinar. So if you did join later, make sure you just rewatch it first, because it's likely that your question may have been answered at the start. So I think we'll have this one as our final question, and whoever would like to take this one. So just, for example, if you put mental health as your preferred specialty and there's not enough spots, can you still be offered a grad position in a different area?
Absolutely. And mental health for Ramsay is the same as what we offer within Ramsay elsewhere. We want mental health nurses. Australia especially, we need it all over the world, but Ramsay Australia are so good with their mental health program, and we're doing some more. We're actually moving forward with our mental health programs and what we're going to be offering within the mental health realm for Ramsay. And it's a very exciting place to be. So that just the spaces in mental health are included in the grad spaces overall. We talk about grad, doubling our grad places or placements. That covers the mental health area as well. It's not just within the clinical, medical side of things, the physical side. Our mental health programs are very, 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 very much available as well within that context. And if you found that there wasn't a space for you, which I highly doubt that would happen because we're very good at moving things around a little bit to make it work, then yes, you could go elsewhere within Ramsay, and we'll look after you.
Awesome. Okay, guys. So we have our final question. So the email details are up there. Make sure you take note of them, guys, so you can ask all those questions. I see a bunch of people still had questions, and unfortunately we couldn't get to you guys, but just shoot them an email as well. So the last question for the two of you is, what advice would you give to someone about to commence a graduate nurse role? And anything else you want to add in that you haven't got a chance to say so far. So Hannah, would you like to start with that one?
Yeah, I think be kind to yourself when you're going into it. Know that you are still learning, and we know that. We expect you to still learn when you come and start your career with us, and that's okay. There might be skills you've never done before. We're excited and very happy to support you through all of those challenges. And I guess be excited. You're going into the business of saving lives. This is, people allow themselves to be vulnerable with healthcare workers, and that's a privilege. And it's a privilege to be with someone in their greatest time of need. And it's an exciting career. There are really unlimited available opportunities to you, and I'm really excited to be able to share them with you when you come through to Ramsay for the graduate program. But I'll leave it with you, Charlie, to wrap up, because you always have
I echo what you've said. I think the advice I would give you, from me, remembering how I felt when I was a grad, and how my journey has gone. I think be open-minded, because healthcare changes all the time. So be open to learning new things. Be vulnerable. I've said that already. Be flexible. Be flexible with your time and how you spend that time. Make sure that you are not focusing on just one thing. Like, open your mind up and have a look at what's out there for you. We do offer lots of things for you to look at, lots of different streams, different education opportunities. So just open-mindedness, and just have fun. Laugh at least once a day, because it's fun. It's not that scary. It's scary sometimes, but you got to laugh, because it's the most rewarding job. You'll go home some days, you'll be tired, and you'll be, whew, that was a hard day. But just think about all the things you've done to help those patients, those customers of ours and patients who are so vulnerable, and you've walked away and they feel safe because you've looked after them. How amazing does that make you feel? So yeah, and just enjoy the ride. We're there to go along with you on this ride, and we are so eager to see all of you join this amazing company, this amazing healthcare provider. So yes, get your applications in. We can't wait to meet you.
Awesome. Thanks, guys. I feel like this has been such a great session. We've had so many questions. We really got to go into so much detail. So I'm really glad we got to have both of you on and help everyone go through their questions. Guys, make sure to take note of the emails. And I'm really sorry if we didn't get to your question, but I'm sure Hannah and Charlene can help you out after this webinar. Yeah. So just to wrap up today's session, everyone. So first of all, thank you to Hannah and Charlene for joining and spending time with us on a Thursday afternoon.
So welcome.
Awesome. And, if you guys want more information on Ramsay, definitely go and check out their employer profile on Grad Australia. There's so much information. The profiles are really, really detailed. So that's a great place to start if you also have more questions as well. And then for anyone else, we do have a bunch of career talk sessions that go on 2 times a week. So if you know anyone in other areas, business, insurance, anything, we always have so many different topics for other students as well. So make sure you share it with your friends. If you found it useful, make sure you help them out so they can also get their dream graduate job. So next week we have, it'll be on the social. So just check the LinkedIn, Facebook, and YouTube, and you can subscribe, register, whatnot, and get updates on when our next events are. So yeah, make sure you guys check out Ramsay on Grad Australia. And if you have any questions or you want to reach out to any of us at all, you can contact me as well on LinkedIn, or contact Charlene and Hannah via their email that we've just popped up in the banner. And I think that just brings us to the end. I don't think there's anything else to discuss. So thanks so much, guys. I can see all of your comments.
You.
Caitlin,
good luck, everyone.
Justin, Simon, Ari, thank you so much for joining us today and asking us questions. It was awesome. And yeah, make sure you guys follow our social medias. We'll be posting a lot of this content as well in different formats, short videos, written content. There'll be a bunch of things to come out from this as well. So if you want to refresh your brain in like 2 weeks with some of the key takeaways from here, then make sure you follow our socials at Grad Australia. Okay, guys, I think that is the end. Nothing else from me. Anything else from you guys? Otherwise, I think we'll say bye to everyone today.
Thank you so much for having us. We've been really excited to be here, and we hope to see lots of you through Ramsay.
Agreed. Yeah. Thank you, and good luck with your applications, and we can't wait to see you.
Yeah, we can't wait to get them.
Awesome. Good luck, everyone, with your applications, and thank you so much for tuning in. See you next time. Okay. Bye-bye, everyone.
Thanks.